What's the most unprofessional thing a doctor said to you? I was getting a colposcopy. I had HPV and an abnormal pap, so they were checking for HPV-related precancerous cells, and the usual NP who I go to wasn't there. The male doctor asked me how many sexual partners I had, and so I answered honestly. He replied, "That's way too many and you need to stop." Then I had to lay there while he chopped a few pieces off my cervix. It was fairly painful. I held it together but sobbed the second I got out of there. The fun twist is that I had gotten HPV in a monogamous relationship. I wrote a complaint to the hospital, but never heard back. Well, I have been harassed by two different doctors. One was a dermatologist and I was about 15. He used to look at me in a way that really made her uncomfortable and told my mum I should lose a ton of weight because that way I would be beautiful. I asked her not to take me there ever again. And then when I was like 29, I went to an orthoptist with the excuse to show me some exercise and up on top on my with his junk on my face. I left running from there and never came back. Mind you, I'm not an incredibly beautiful woman, more like average. But these doctors were wild. Already, and my knees kept dislocating. They still do it, mind you, and my doctor, who I had only met half an hour ago as my normal doc was out, told me my mum, I was 16, her knee goes out because she fat. This woman was white, skinny as a twig, and said it point blank. Turns out neither knee has a definite spot from the trauma from when I was a kid. I fell down a hill too many times. Had to go into the office raised law. They both free float and just stay in place cause the meat around them keeps them pinned. Are we counting therapists here? My first session, I mentioned wanting to work on my emotional regulation because my boyfriend and I were getting into a lot of fights and I was spending most of my time crying. Instead of it asking me about the boyfriend, she said that I was probably prone to throwing fists when I don't get my way because I'm the youngest child. She had no context for what my BF and I were fighting over. Didn't know anything about my upbringing other than me being the youngest child. I was so stunned I just left without saying anything. Wasn't said to me, but I had to get a liver biopsy a few years back to determine the extent of cirrhosis I have. A resident med student did the actual procedure while the attending head doc supervised. She went in once with the needle, brought it back out, and she and the other doc looked at the sample size she pulled. He said that it wasn't a large enough chunk, so she'd have to go back in and get another. Her shoulders kinda slumped and she said to him, "Okay, but it's, like, really crunchy, so it's hard to get a sample." That was really reassuring. Oh, I have one. When I was maybe 6 or 7, I used to get some nasty headaches. My mother took me to the doctor who had me have an x-ray done of my head, never checked. But I am sure this is not the way to go about it. When we received the x-ray film, my mother took it to the doctor who inspected it briefly and asked my mum if she has other children. My mother, confused, said she has one more daughter, and the daughter replied saying, "Oh good, because your son has a brain tumor." I had fucking boogers for fuck's sake. Headaches were caused by sinusitis. In my mid-20s I started having chest pains and extreme pains during certain stimuli, such as being asked upon during a work group meeting, or when driving. The chest pain was severe and sharp, and all I could do was concentrate on my breathing to get past it without, in my opinion, passing out and dying. Went to a doctor and he utterly humiliated me. Asked what the real reason I was visiting the doctor. Did I need to be tested for AVD? Was I feeling strange when I looked at men? After I left, never went back to him for anything ever. Not a doctor, an osteopath had been going to for help with shoulder arm pain, not to me, but about me. The issue had been going on for several months and was causing a lot of pain. I wasn't sleeping properly and no one seemed to have a clue what was causing it. Everyone kept telling me what it wasn't, but no one could tell me what it was. One day I broke down in tears. He ended up writing a letter to my doctor in which he described me as emotional hormonal. I was furious. I bet he would never talk about a man in those sort of terms. He sent a nurse to tell me my son wasn't viable, and since the meds didn't stop labor that we would have to try again for another kid. Thankfully, I had preterm labor complications that ended well, so I informed the nurse that he had 20 minutes to get his back to the hospital and figure something out. That with my last pregnancy, 11 years previous, they had more options, and surely there had been advancements in medicine. Labor was stopped and I delivered full term. But man, what an absolute disgrace to medicine that doctor is. When I turned 35, my doctor asked me if I was planning on having kids. I was single, so I told her it seemed like a non-issue. To which she replied, "Good. Well, you need to tell me immediately if you change your mind, because your genes are now degenerated." Lot of time around doctors throughout my life, so I knew she meant to say that the risks of complications increase significantly on a statistical level when the mother conceives after the age of 35, but that's what she actually said. On my third trip to the ER in 32 hours for extreme back pain, the doctor thumped me right in the lower back, which put me into a full body cram. I started hyperventilating and scream crying. Great, that tells me what I needed to know. He walked away without anything else and left me on the exam bed twisted up and crying for what felt like a good 20 minutes. Eventually I got prednisone and morphine. That third visit, all my tests and missed billing were written off by insurance. I still wonder why. I had a surgical procedure done. I specifically asked not to be sedated enough to lose consciousness since it terrifies me. Nicked me with the scalpel in a non-sedated area by mistake, making me twitch from the pain. Instead of, being careful and not doing it again, she made a very annoyed grunt and told the anesthesiologist to put me to sleep. I still avoid anything that might lead to surgery. I really don't trust surgeons and don't want to take the risks of being fully sedated again. Mum and I used to be able to tell which surgeon was a good one and which was shit by their response to hearing the name of my ultra-rare medical condition. Less than 30 cases globally very recorded. The ones that admitted they didn't know much or anything were the good ones. The ones that went, "Oh yeah, I've heard of that before. Remind me about it," were the ones that we never went back to. So many were the latter, lying to me and Mum and showing how unprofessional they were. Was at my annual gyno appointment a few years back and had an older female doctor. She was in the middle of the already uncomfortable actual pap smear when she grumpily declared, "We'd be done if there wasn't all this crap in here. For clarification, there was no actual crap in there. I was on ovulation and it's normal for me to have heavier cervical mucus." I have never been so embarrassed and humiliated in my life. I obviously requested to never see her again. A note: I needed to receive welfare benefits. I'm not from the US. Things work differently here, I think. She said to me that the reason for her procrastination was that she is a busy mother of 3. Understandable. But I had no income while waiting for the note from her. That paper was important and my income was dependent on it. If she was too busy to write it, she wasn't fit enough to be working at that time. Doctor yelled at me about me misidentifying my headaches. "You have trigeminal neuralgia. Why are you coming in here telling me you have headaches? You have nerve problems. Why you say headache?" Well, my face, which is fucking attached to my head, feels like an ice pick is through my and out the back of my skull. Hence my fucking head hurts. You're the doctor. I came to you to see why my head hurt if I already knew I wouldn't need you. Asked neurologist for an ADHD test and she asked what my issues were. Told her about my symptoms, including not having been able to finish any degree school because the education system is not made for neurodivergent people. She said, "Or maybe you're not smart enough." That one comment fucked me over pretty hard for 6 years and cost me a lot of therapy. Wasn't the best thing to say to a person with severe imposter syndrome. Doing better now though. I'm a pretty pale guy, but I spend a lot of time outside for work. At the dermatologist for an annual skin screening, I made a joke about how I'm extra on top of wearing sunscreen and sun protective clothing because I'm relatively fair-skinned. The derm, without pausing from his work, said, "Ain't nothing relative about it, brother. You're only a shade or two away from being translucent." The whole point of the trip was to avoid sick burns. That clear anal discharge was a normal thing. My response was to ask him, all the nurses still in the room after my colonoscopy, to all turn around. Because if this was normal, I should see wet spots on at least 1-3 of their asses, maybe 1-2. I think one of the nurses even snickered. I'm too familiar with how horrible women are treated by healthcare professionals to just accept BS. When I hear it, reality. I had a blocked bile duct. I went to the doctor to get my shoulder looked at after injuring it during a workout push-ups. He kinda half-assedly told me to raise my arms, lower them, push them together, then apart. And then he proceeds to tell me there's nothing wrong my shoulder, there clearly was. It hurt like fuck, and he adds at 35, don't expect to be able to work out with the same intensity as you did at 25. I'm like, FFS. Dude, wanna arrange for my funeral, too? Shrink doctor, he talked to me for 5 minutes. Diagnosed me bipolar, shoved some free samples of Latuda in my hands, and then spent the rest of our session audio recording his notes on me. As in, patient exhibited signs of nervousness, delusions of grandeur, and has unrealistic expectations of blah 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 in front of me while I was gaping like a fish. Side note, I got a second opinion. Turns out I'm just depressed. I'd went for back pains. Feared it was kidney stones. I was on a 2-liter of Mountain Dew a day diet. He accused me of having kinky sex and hurting my back. I did it pushing carts at work. Refused to believe me. He told me it was just sciatica. Nothing could be done because I was young. Gave me a prescription for Oxy and told me if I need more just call and have me a wing. 5 years of daily pain later, I fixed it with yoga, thankfully. I was on low-dose naltrexone as an antidepressant trial. Naltrexone is a drug given to people getting off opiates, but in a large dose. I had the flu really bad and was in the urgent care. The doctor told me he was going to give me pain meds, but since I'm on naltrexone, he didn't finish the sentence. He just said that to me in a terrible tone with a huge sneer on his face. I knew exactly what he thought of me but was too sick to care.